somehow almost a huge percentage of people experience this um, abuse as a child, especially the girl child. But really, it's not about the girl child now, it's about children. Because before now, we used to think, oh, the girls' children are the ones more vulnerable. But the truth is now, even the boys' child are very, very, very at risk. All right, so we've done a series on healing conversation on childhood trauma recovery, and we had 7 week series of healing conversation with Abokede, talking about healing from childhood trauma. So we are continuing this conversation. We are looking at safe and smart parenting series. So this is the series we're talking about now. We're going to be having this conversation the next about 8 weeks. So make sure you join me every Sunday at 7 p.m. as we have this amazing conversation on healing and preventing abuse of children, child protection, family life education. So that is what this is about. We talk about trauma recovery, childhood, child protection, and family life education. So if you are joining me for the first time, I'm Patricia Abokede and I'm your host. So for those who are not familiar with this channel, make sure you go to the channel to see our previous discussion on childhood trauma, how to heal, how to recognize if you some people did not even know they went through childhood trauma. So probably the conversations we've had previously is going to expose your mind to know if you actually went through childhood trauma, how to recognize your feelings, how to identify with yourself, and how to heal. So this week, today, we're starting a new series titled Safe and Smart Parenting series. So join me as we continue. So I am Patricia Abokede. I'm a child protection advocate, a trauma recovery coach, and a family life educator. All right, I'm also a parenting coach. So I work with parents, educators, school owners, child care givers, anybody that is into children things. Of course, if you have a child, you are my client. So and I help you to raise healthy children, raise have a healthy family life, and raise safer communities. Because when we have healthy family life, we have safe communities, definitely our children are going to be protected. So join me every Sunday as we continue this conversation. So today we are looking at a very sensitive and important topic, and we're looking at signs of child sexual abuse every parent must know. Signs of child sexual abuse every parent must know. That's what we are discussing today. So make sure you stay with me, because I'll be discussing something very, very important towards the ending part. Make sure you stay till the end of this video and this discussion, so that you can get the best of this conversation. So now, before I go further, I want to clarify something. This session or this series is not for us to, I'm not here to create fear or to, to create fear on for anybody, or to create I'm not here to make you be afraid. Because when people hear, some people, when they hear the conversation on child sexual abuse, the reactions sometimes, or the mindset is not always palatable. Excuse me. Sometimes people misinterpret when we're talking about this child sexual abuse. People bring in fear, they bring anxiety, or or it triggers negative memories. I'm not trying to make you begin to be unnecessarily anxious. I'm just creating awareness for you, so that you can be more aware of your environment and provide protection for your children. That is what this program is all about. So And because awareness is something that every parent must have when it comes to sexual abuse. It's happened in a subtle way that you may not even notice. In fact, some children are abused right under the nose of their parents and they don't notice at all. So I want you to stay with me till the end. So I'm very, this topic is a very sensitive topic to me, and I'm very, very passionate about it because, as a matter of fact, my calling started with conversation on sexual abuse. When I started my activism, I started with the understanding that there's a need for campaign against sexual abuse. That was over 10 years ago. And because a I had an experience, I'm a survivor of child sexual abuse, because of lack of awareness of my parents. They didn't even know, they didn't even know that anything like that happens. They trusted some people around us too much, that I was very vulnerable. And I grew up to know that some of my siblings also experienced similar things. So this is something that undergoes in homes, in communities, in schools, in churches, in different places, places that you even think is very safe. Excuse me. Excuse me. A lot of children are vulnerable. A lot of children are vulnerable to sexual abuse. Follow the other door. A lot of children are very vulnerable to sexual abuse because parents are not aware. And it's very important for us to be very intentional when it comes. And also, like I said, when I started my activism on sexual abuse, I started on child protection. I started with child sexual abuse prevention. Now I joined a network of people who were interested in child abuse. We call it child protection network. So I stay in Oyo State, Nigeria. So I joined the network, and what we did majorly was to pursue cases of children who have been sexually abused. And my experience then was very, very devastating because we had a number of cases we have to pursue, good cases, children who were sexually abused. We caught, we had evidence. Over time, when we take the cases to court, we do all of these things, the system spoils these whole cases. In fact, the parents will say they withdraw, they don't want to fight any case. They blame the child for exposing the abuser. Sometimes the abuser may be somebody the child love, maybe the father, sometimes the uncle, somebody they care about, and they don't want to be the one to bring discord in the family. And then a lot of things happen. Sometimes they will withdraw those children completely from us and take them to the village where we cannot even reach out to them. If you call the parents to come for counseling, they don't show up. So I realized that the fight against sexual abuse, when it comes to it has happened, when the exact, when there's an incident, is more difficult to fight for so many reasons, especially in parts of the world, where we value family system so much more than justice, or so much more than allowing the law to take place. A lot of people want to protect the name of the family, want to protect the name of the school, want to a lot of things. So why wait till something happen? Why don't we prevent it? Why don't we focus on prevention? And then okay, hello Leah, you're welcome. I would like to know where you're connecting from. Please let me know where you're connecting from, so that I can be sure of where I can know how many people I'm reaching, or how far this program is going. So I prefer prevention. It's better for us to prevent abuse from happening than waiting until something happens excuse me, then we start looking for how to, you know, prevent health issues, how to go litigate and all of these things. And it's a whole lot of fights you wouldn't want to go through. And I also know that as much as it's not so easy in Nigeria, there are some other countries too that this matter of sexual abuse fight is not that easy. And a lot of stories are covered, a lot of stories are put underground that children and a lot of victims are not allowed to. Oh yeah, okay, thank you. Hi, hello, Leah, I believe. Thank you for joining us on this show. So I would like to know, those that are connected here, where are you connecting from? I'm talking to you from Nigeria. And like I said earlier, this is a conversation on prevention of childhood trauma. We've had series of conversation earlier, so make sure you go through the channel to see what we have been discussing. And I would like your comments. Give this channel a like, share with somebody who needs to hear this. Today we are talking on signs of child sexual abuse every parent must know. So I would like to know you. If you know any parents, you know a child caregiver, or you are one, I would like to know, are you a parent, are you a child caregiver, are you a social worker, or what is your area of connecting with children? I would like to know. All right, so let's lay a very important foundation. All right, children don't always speak up when things like this happen, and this is mostly because they are not well informed. Children don't even know what is right and what is wrong. It is the duty of the parents and their caregivers to guide them, to educate them on what is wrong. So children don't speak up, not because they are okay with the situation, but most of the time they are afraid. They are afraid majorly because people who abuse children are majorly people they love and trust. Excuse me. It could be a family member, it could be a teacher, it could be even their Sunday school teachers, it could be somebody close to them. So they are afraid of what is happening. Sometimes they are confused. They can't even separate what is right, and the fear of, okay, if I tell this person, would they believe me? Sometimes the abusers threatens them that if you tell anybody, something bad will happen to your parents, something will happen to you, something will happen to somebody. And they want to protect their family. They want to protect they want to protect the people around them. Or sometimes, okay, Leah, kindly subscribe. I've mentioned you, so go ahead and subscribe. All right, thanks for joining. I would like to know where you are connecting from. If you are still here, I would like to know where you're connecting from. Which country are you connecting from? I would like to know. Thank you for joining me, everyone here. I love you. I appreciate you. Good. So another thing again is that the children that become a victim to these predators, they don't even know the right word to use, because a lot of times parents don't start early conversation on body safety discussion. Many parents don't start that early conversation, and because they lack the right word to use, some people even call their children's private parts cute names. And because these children lack the right word to use, they don't know how to express themselves. They may want to protect their abusers, and that is why parents need to be informed about this attitude, this behavior, this form of abuse, know what sign it is, and how to prevent, how to approach a situation that threatens your child. It's your duty as parents to protect your children, or as a caregiver, maybe you're an uncle, maybe you're an auntie, it's your duty to protect the children around you. So why this is why behaviors, most times because children don't know how to communicate, they express the signs in behaviors which you need to pick. So as parents, you must learn to watch out, you must learn to listen and observe, so that even if you have educated your child, chances are, it doesn't mean that they may not be exposed, but at least they are informed and they can be able to communicate clearly to you. But what if you have not started? So let's go deep into this conversation. Also know that one sign alone does not confirm that a child is going through abuse, but patterns and sudden changes should never be ignored. So there are some patterns, there are some things that should never be ignored if you notice it in your children. So I'll be sharing with you. So quickly give a like to this video, share with somebody right away, and subscribe to this channel to get more of our videos and join our conversation. I would like to know where you're connecting from. Kindly put that on the chat. So let us begin to look at the behaviors or the signs, the behavioral signs you need to take note in case a child excuse me, in case a child is, the behavioral signs a child may be exhibiting that you need to pay attention to in case a child is experiencing sexual abuse. One is sudden behavioral change. What are those sudden behavioral changes you see in a child? That child who was once a happy child becomes to withdraw. The child that was excited, always happy, begins to withdraw, doesn't participate in activities again. The child suddenly became you really cannot understand that child easily again. The child become calm. The child that was calm before begin to be aggressive, becomes very aggressive, or become socially isolated. I watched a clip recently. It was just a social media, all these random skits, but it's questionable. So the script was like a man which was supposed to be a stepfather asked a girl to give him water, and the girl snapped at the man, go and take it yourself. And the mother came and scolded the girl and beat up the girl and said, in your life you must not talk to my husband like that again. Is apparently, according to the skit, the father of the girl, who was the woman's husband, sent them out of the house, and this man took them in and all of that. So my reaction to it was, what if this man was already giving advances to this girl? Because children don't become rude overnight. They don't just suddenly become rude. If you notice that a child who was social before, very active, a child that used to play, a child that was very calm, suddenly become aggressive, suddenly talks at an adult anyhow, or talks back at the cousin anyhow, or talks back at the uncle anyhow, or withdraw, doesn't want to see them excuse me. Maybe before now, when that person comes, the child is all over that person, and suddenly the child, when he sees this person is coming, withdraws and isolates herself or himself until that person leaves. Trying to avoid social contact. Don't force that child on that person. It's possible. Not, like I said, don't be overly suspicious. Watch out for signs. It's possible something is going on and the child is using behavior to communicate to you that something is going on. Because as a matter of fact, well, especially for the African cultures, children don't become aggressive to adults or become rude to adults suddenly. When you begin to see that a calm, respectful child suddenly become aggressive, to withdraw, suddenly okay, when you notice that a child is beginning to, the attitude completely change, you need to be intentional. Don't just ignore that behavior. So sudden shifts are very important pointer to something is happening in the life of that child. It may be in the house, it may be in school, maybe somewhere. So pay attention. This make attempt to understand what is the child is going on, is going through rather. Now, number two is fear of specific persons or places. If a child begin to, maybe before now, you say we are going to uncle's place, we are going to this person, but the child begin to say, I'm not going, I don't want to see that person, and the child begin to suddenly avoid someone or cries when going to a certain place. If a child, maybe a toddler or a younger child is no longer excited about going to a place, no longer excited, no longer interested in a place they love to go before, chances are there's something the child is avoiding in that place, and don't ignore it. Don't ignore. Children may not explain, especially if they don't have word for it, but their body reacts. Remember from our previous conversation, we have said that body reacts to trauma. So when a child is beginning to be afraid of a specific place, some of us parents, because we don't reach through the mind of the children, we don't try to understand the child. The child say, I'm not going there, I don't want to see this person again, and all that. Just what is wrong with you? We get angry at those children, we get frustrated, and we begin to lash our frustration on those children. It's possible the child is trying to tell you something, but they don't actually know the best word to use. So watch out for that. Number 3 is regression. So regression, a child may begin to, the habits they have overcome, maybe they are a milestone they have achieved and have outgrown, a milestone that they have achieved or have grown, they begin to regress. For example, a child that has stopped bedwetting suddenly start bedwetting, or the child starts sucking their thumbs, or act younger than their age. Something just happened in their brain, and the brain cannot accept it, and the brain regress. It could be. So when you notice that there's a change, there's a regression in a child's habit, maybe a child that has stopped bedwetting, a child that has stopped sucking their fingers, a child that and the child begins to act like a child is already mature, behaving like a mature child, and now is behaving like a younger child. Then it's possible something is going on in their life you need to pay attention to. This is often a sign of emotional distress. When a child is emotionally distressed, their attitude withdraw. Just like even an adult who is seeking an attention from the spouse or something, see the way a grown woman can behave, like a child. Talk less of a child that is really, really going through abuse. So pay attention if you notice that a child you have around you in school or at home is regressing in their attitude. They were doing well before in exams or in their academy, and they are not doing so well again. It's possible something is going on in the life of that child that I need to pay attention. So it's not all the time that the child comes back with poor results. Maybe a child was in the A, was was an A student, and the child is getting to C, and it's not all the time you just get angry and say, what is wrong with you, and you start beating the child. No, it could be that something may not even be sexual abuse, maybe something is entirely, maybe bullying, maybe something is entirely that the child is going on, that is going on in the life of the child that you need to pay attention to. So number 4 things you need to pay attention to in the life of a child that is going through sexual abuse, or that can give a sign that it's possible this child is going through is some abuse or trauma. Excuse me. So a child that is having sexualized behavior beyond their age. Now there's what is called age appropriate sexual orientation. Everybody is a sexual being, and there's a level of knowledge you should have per time. So when we talk about age appropriate sex education, we're talking about you educating your children based on their age, what they need to know at a particular age. For example, a newborn baby, a toddler, an infant, all they need to know at that time is calling their private parts their real name, and letting them know that mommy or daddy or your caregiver is the one that should wash you if you mess up. But if somebody is touching you and your private part is paining you, then you need to report. That is just about what they need to know. But when you say child that is having too much knowledge about sexual acts beyond their age, inappropriate, they are having, a child is attempting inappropriate touching, or a child is explicitly speaking sexualized languages, then it's possible somebody is talking to this child or is fiddling with this child, and you need to pay attention to that. There's level of exposure every child should have when it comes to sex education. A child that is knowing too much, is touching, is trying to play, is doing exhibitionism, or trying to touch an adult inappropriately, it's possible somebody is also doing that to the child, or the child is talking carelessly about sexual matters. It's possible somebody is talking to that child. I need to pay attention. It's a red flag that you cannot just ignore. You can't just ignore it, because as a matter of fact, many predators break boundaries. They gradually break boundaries. By next week, excuse me, I'll be talking about how predators attract their abusers and even their parents, how they make their praise comfortable around them. So make sure you don't miss next week conversation. All right, so we need to pay attention to the red flag. So number 5 is withdrawal or isolation. If a child begins to avoid interaction, a child becomes unnecessarily aggressive, unnecessarily confrontational, stays alone often, that before now. So I'm talking about comparing what the child used to be and what the child is doing now. Before now, the child would naturally join conversation, naturally come to the sitting room to watch TV with everybody, naturally do things with the family. But now the child is withdrawn, or you notice that the child's eye is always red. The child is suddenly afraid, suddenly is fretty, is is not just comfortable again, lose interest in normal activities. Then you need to pay attention. Something may be going on in the life of that child, and you need to pay attention to help that child. So we have talked about behavioral things you need to pay attention to, and we've also talked about sexual behaviors beyond the age of that child, things you need to go pay attention to. Now we are looking at emotional signs. How do you know? What are the emotional signs that can point to the fact that something is going on in the life of this child? So first is anxiety and fear. Now, the child may seem constantly afraid or tense. You know that children are very free. They are very fun to be around. They are very, a normal child is just excited. But this child now suddenly become anxious. There's anxiety, there's fear. Maybe you call the child is startled. The child is always, the child is not comfortable around you again. The child is anxious. You talk about something, the child say, no, don't talk about this person, don't call this person. You mention the teacher, the child, no, don't tell my teacher, don't things like that. It's possible something is going on in the life of that child you need to pay attention to. Second emotional sign is depression and sadness. Naturally, children are excited people. They are not such, it's difficult to see a generally sad child because they don't have worries. They are just excited. All a child knows is to eat, is to play, and for the older children to just catch fun around their friends. Even teenagers that are normal teenagers, not doing anything silly, are just excited about maybe playing game, doing something fun around them. But suddenly you see a child that is depressed or sad. They may cry often. Every time you see the eye bag, the child is red, eyes red is red, or the child is sulking, all the time. There is no joy in the face of that child. There's kind of hopelessness. you know you may need to pay attention, and this is very important, especially for teachers, for children caregivers, because so many times children go through a lot at home that teachers may pick. It's also very important for parents also to pay attention to children, because children go through a lot of things in school that the parents may pick at home. Imagine a child that is coming back from school and is not excited about school, and you say what happened to school. There's nothing good about school today. The child gets home and dropped his bag or her bag and went inside and locked herself or himself up in the room for hours. You want to find out what happened to this child, what is happening in school. Or a child that came to school and the eyes are red, the child is not paying attention in the class. Anytime you look at the child is lost in thoughts. Something is happening in the life of that child. You need to pay attention to. You need to be aware. Don't just ignore. Don't just say these children, these rich kids, or these children of nowadays, they are spoiled. These Gen Z children, don't excuse it away. Don't assume the child is just being rude or is just being naughty. There may be something bigger than what you are looking at. There may be something bigger than that, and you need to pay attention. It's our duty as parents or caregivers to notice these things. Another emotional sign you need to pay attention is guilt and shame. So a child that keeps feeling guilty, some children may say things like, it's my fault, I'm bad. It begins to affect their their self-esteem. They begin to feel guilty about everything. They begin to feel bad about everything. They blame themselves for what happens around them. It could be that somebody is threatening that child, and you want to know better. You want to pay attention, even when they have done nothing. They are always, no, it's my fault. They are taking blame for everybody. Something is wrong. Number 4 emotional sign is low self-esteem. See, one of the worst form of abuse is sexual abuse, because sexual abuse steals the innocency of that child. It steals away the childhood of the victim. This is something that should not be done with children. So once you break that barrier, you have stolen the childhood of that child. So obviously, except the child gets help or heal from that trauma, it affects the self-worth, the self-esteem of that child. And that child may grow up to have low self-esteem, feeling unworthy, feeling dirty, feeling ashamed, feeling not enough, feeling like, oh, because I'm beautiful, that is why this is happening to me. Or because, just blame themselves or have extreme low self-esteem because of abuse. So parents need to pay attention to this. If you notice a child that is not confident, of course, confidence is built. It's not only sexual abuse that reduce a child's confidence. A lot of things. If you watch my previous video, I discussed a lot. A lot of things, like the way we talk to our children, the way you relate with children, the name calling, in so many ways. the child can lose self-esteem. But this is also very important, and it's one of the key major factor that makes children lose their self-esteem. Excuse me. So we're looking at the physical signs now. Physical signs you need to pay attention to if a child is going through sexual abuse. We have talked about behavioral signs, we have talked about sexual orientation signs, we've talked about emotional signs. Now we're talking about the physical signs that a child is going through sexual abuse. Now I want to be careful to talk about this physical sign, because it's very important for us to note, to be attentive to our children. So this may include difficult walking or sitting. Now this is when there's a penetration. Imagine a child, especially I'm not even talking about girl child, but when you talk about sexual abuse, it's both boy and girls now. Before now, back in those days, we used to focus more on the girls, but even the boys are also prey to predators. So don't ignore any child. Don't say, I remember a mother once told me, and said, I don't have problem with sexual abuse because I have boys. It's not like that too. Boys are also being abused these days. Excuse me. So now, difficulty in walking. A child came home and is not walking normally as expected, or the child is not confident in walking. Something could be wrong. Pain or discomfort in the private area. This has to do with penetration now. Maybe there's a rape, or or somebody is touching the child in an inappropriate way, and it could lead to all of this. Unexplained injury in the private part. Say you are beating a child, a child that's a younger child, and the child is kept saying, no, don't wash my, don't wash that part of me. And anytime you want to wash, the child is screaming, is crying. Something is wrong, because it's not meant to be a painful part. So if a child is screaming or fidgeting about you washing their private parts, a younger child, something is wrong. Okay? Then frequent urination. The child is frequenting the toilet. It's possible the child has been, something is wrong. And of course, if it's a physical, if it's a rape case or a violent case, you may see signs of scratch and physical body scratch and all of that, struggle with cloth and all of that, torn cloth. A child coming home and you see the cloth is torn, the body is injured. Don't ignore and say, where are you coming from? And just no. Even if it's your house help, because some parents can take good care of their children, but the person that is living with them, their house help or their nephew or their niece, they will ignore. Why? Every child under your care should be protected, because the truth is that if you ignore other children and you're only looking at your own child, what happens to those children may come to your doorstep very soon. So don't ignore any child. Every child is going to be an adult one day. I never can tell how the tiles will turn around for you. So very important, do not jump at conclusion because you saw this, but do not also ignore consistent signs. If you are noticing some signs, don't ignore. Seek professional medical attention when necessary. So if it's a physical sign, a child kept saying, I have toilet disease, some people call it toilet disease, they have sexually transmitted infection and they call it toilet disease. You want to know, why is the child having toilet disease all the time? Why is the child coming home with STIs? What is happening? You want to know, go to the hospital, examine the child. Probably the doctors will help because they are professionals to ask some very important questions. It's important to do that. So I also talk about digital online signs. In this digital age, children are also being sexualized online. You need to pay attention to what is happening in your children online. Because we have had situations where excuse me, young children are lured online to places that are dangerous and they don't tell their parents. This matter of falling in love and crushing and things like that are new to them. Emotional phase. I'm talking about teenagers now. Their emotional um, feelings, their love feelings is new. All of these things are new to them, and they can easily be swayed off if they are not properly guided. So when it comes to their digital life, maybe the child is having secret phone use. The child is supposed to be off screen, the child is hiding to be texting, hiding to do video calls, things like that. As a matter of fact, if you are a teenage parent and your children are using phone, let them feel confident using phone around you. But when they are hiding things, you are coming and they are quickly offing their phone, they are hiding, it's possible something is happening. You want to know, are they communicating with somebody, you know, that can harm them? Because the world is funny now. A lot of things happen on internet that you need to pay attention to. Studying new friends online. There's a way you can connect your children and social media to yourself, and you see that there's a new friend. You want to check, who is this person, and make your children feel comfortable talking about some things around you. Some parents are so autocratic, authoritative, that they don't even allow their children to come around them to have conversation to, and it can be dangerous, because when those children are in trouble or they need help, they won't be able to approach you to tell you what they are going through. Now, when your child receives gifts or airtime unexpectedly, why is somebody giving your child gifts? So I teach teenagers, if somebody is giving you gifts excuse me, you want to know why, because gifts, usually you get gift for a reason. So somebody is giving you gift, you want to know, why are you giving me gift? What did I do to merit this gift? You don't just take gift and take gift and take gifts. There must be a reason for somebody giving you gift. So when your child keep coming on with a gift, somebody gave me gift, somebody gave, you want to know, who is this person and why is this person giving you gift? What is the rationale behind this gift giving? So emotional changes after use of device. So okay, child just finished using phone and got angry, became aggressive, suddenly become unnecessarily angry. Something went wrong on the phone. You want to know what is happening. Now, what do you do if you suspect all of these things? If you suspect that your child is going through sexual harassment or sexual abuse, what should you do? First is stay calm. Be calm. you know when I was growing up, my parents never had conversation about sex education with me. In fact, at a time, I asked my mom a very, very, sensitive question, and she shunned me. And after that day, I never, ever, ever have any conversation about thing that has to do with sex or anything. But these days, children have access to information. You cannot pretend to think your child don't know anything. So even if you notice something, be calm. Don't approach it aggressively. Your reaction matters, because if you panic too much or you suddenly flare up, the child will just go inside their cocoon. That was what happened to me. I saw something, I think I saw pubic hair in my mom's. I don't remember. And I asked mommy, what is this? She said, shut up, you this child. What did you? She screamed at me, she talked down at me, and that was all. I never ever talked again. Even when I was abused, things happened, I never told her. She never knew what went wrong. She never knew what happened to me. Even when a lot of things happened, I never told her. because of that shunning down. So don't overreact. Be calm. You know, I told you these are signs, and one sign is not enough to conclude. That you notice something does not mean, oh, it is happening. It could just be, and sometimes maybe it is about to, maybe somebody is trying to groom your child. Like I said, make sure you don't miss next week conversation. We are going to be talking about how predators groom their prey, and even their families, and even their communities. Make sure you join to next week's conversation. So stay calm, don't panic, because if you panic, if you overreact, that child may never talk to you about anything serious again. Number 2 thing you need to do if you notice something like this is listen without judgment. Now, if a child comes to you and says, Mommy, I have something to tell you, and the child begins to tell, and you realize that this is happening, don't judge. Don't scream. Don't say, like a Nigerian parent, this child has killed me, oh. Don't do that. Don't be that Nigerian parent that will scream and say, this somebody take me, oh. This child has killed me. No. Be calm. Listen and believe them. Don't interrupt. Don't say, wait. Is that why I saw you and this person doing this the other day? Is that, no, don't interrupt. Don't blame. Don't start talking. Why won't it happen to you when you wear skimpy clothes? Why won't it happen to you when you use this? No. Don't blame them. Don't panic. Don't interrupt. Just be calm. Be mature. Be prepared. Like you've had this now, and you begin to notice anything around what I've shared earlier. Don't panic. Because if you panic and you scream, you overreact, that child will shut up. So we want to get we want to get to the root of the matter. So for you to get the truth and for your child to heal, in case the child is already being molested, you need to help that child by believing in that child, by listening to the child, and by taking steps. So say things like this: I believe you, it's not your fault. Please don't blame any child that is being molested. Don't blame any abuse or victim of an abuse. No, it's not the fault of the abused or the victim. It's the fault of the abuser. Now we're talking about child sexual abuse. Most times people who abuse children are much older than them. So they know better. They know that this is a child. I shouldn't do this. Not the child. Excuse me. So do not interrogate. Avoid asking too many questions. Like I said, believe them, listen to them. Don't start asking questions. Don't start being suspicious. Oh, the other day I saw you with this person. Is that what people are doing? The other day I saw this. Oh, the day you went to Mr. Laguja's house. Is that what you went to do? Don't unnecessarily ask too many questions, because the child begins to be afraid, and you don't also know what is going on in the mind of that child. You want that child to believe you enough that you trust him or her and you want to help. Let trained professionals handle detailed questions. You're not trained to ask questions. You are a parent or you are a teacher. It's good that you invite professionals who can properly ask the questions and hit the nail on the head. This will help your child, and it will also help you, because when we have cases of abuse like this, it's not only the child that is abused, even the family feel the trauma. They feel pain, they feel betrayed, they feel the pain that their child is going through, all of that. So it's not a one person thing. So if something like that happens, we want that child to heal, to come out of that abuse if it is already happening, to heal. And we also want the parent to heal, the community to heal. It's just one person's thing. A matter of abuse, sexual abuse, is not a person's problem. It's a community problem. Another thing you need to do is ensure safety. Remove the child from the potential danger immediately. So if you notice that the child is being abused, maybe by somebody in the house, if it is your house, you may have to dismiss that person. Maybe a cousin came to stay with you. Maybe a cousin maybe is going to school, and your home is the most closest place for the child to settle down before getting a hostel, and the child is molesting your child. Please let the person go. Or is a family member or a teacher that is teaching the child, coming for extramural lessons, and please Take that child away from the potential danger. And if it's a child living with somebody, please report to a nearest NGO. They will know how to help and take the child to his excuse me. They will know how, excuse me, they will know how to help the child to come out of that danger and deal with the situation in a proper way. So ensure safety. Okay. Then number 15 is seek professional help. Don't try to handle abuse alone. Seek professional help. There are lots of professionals out there, psychologists, therapists, child sexual advocates, lawyers, and so on and so forth. Even the police can handle situations like that. But well, I don't know where you are. Sometimes police that are not trained, or law enforcement or agencies or officers who are not trained on matters like this don't know how to handle it sometimes. But make sure you get a professional who can help you to handle this matter very well, if if need be. All right. Reports. A medical professional can also help. Now, when a case of molestation has happened, when I was talking about the physical signs, there's actually penetration. Please, it's very important that you take that child to the hospital. The child or the person may need what is called post-exposure prophylaxis, to also have some medical checkup. Excuse me. There may be need for some medical care for this person. So make sure you take that person or the child to a medical professional or a hospital where the child can receive some help. That is if there's a penetration, in case of rape or something, it's very, very important. And make sure the case is reported to the appropriate quarter. Protect the child's child protection service officers can help you. Counselors can help you. Excuse me. If there's a case of abuse, it's very important that both the child and the parent should receive counseling or therapy. Don't just excuse it away. It's time for Nigerians to begin to appreciate professionals in counseling field or therapies. We excuse me, we have a way excuse me, I'm just recovering from a health issue, so I'll be fine. Excuse me. So if like I was talking about, okay, if you're Nigerian, Nigerians are very good at explaining things away, spiritualizing things. Everything we spiritualize it. A child is traumatized, it's happening in the mind, and we want to pray it away. As you are praying, also seek professional help. There's a part of prayer and there's a part of professional help. You can't use prayer for professional things. While you are praying for the person who is traumatized or is healing, also seek professional help where necessary. Then report where necessary. Follow appropriate reporting channel for your community. There are different districts, different communities, and the way they report. So if you're a Nigerian and you are living in Nigeria and there's a case of child sexual abuse, excuse me. If you're in Nigeria and there's a case of child sexual abuse, we have the Child Protection Network who can approach this matter. So, or just walk up to any NGO near you or any Ministry of Women Affairs near you. All right, just walk up to I believe most NGOs will get referrals or people they can help. They can report cases to. You can walk up to doctor, nurses, counselors. They will know how to help you if something like this happens. Don't cover up sexual abuse. It can be very devastating because it steals the innocency of children. So let's talk about prevention. So the most important way to teach prevention is to teach body safety. So teach children how to protect their body. And that is why I wrote a book, Safe and Smart Exploring Adventure. It's a book that helps children to learn body safety at a very tender age and in a very fun, educative way. Children learn how to prevent or to protect themselves, to prevent abuse or protect themselves in fun ways, through coloring, through singing, through role play. So it's a book that schools can use it, children, churches can use it, you can use it in the home too. There are instructions for parents and teachers. Very fun book. It simplifies sexuality education. So if you are in Nigeria, you can reach out to me. I'll put my WhatsApp contact link on this description. You can reach out, and even if it's outside Nigeria, we can ship it to you. All right. I'll also put the description to the bookstore where you can make your order on this the link rather, to get your order on this channel, on this description, so that if you are close by and you want your children to learn early body safety, this is a book that is very, very good for parents. Number one, it helps parents to start the conversation in a very simple, child-friendly way. No fear, no stress, in a way that the child can understand it, in a way that it doesn't bring confusion or fear even to the parent, because most parents want to help their children or they want to educate their children, but they don't know the right words to use, and this is what this book is doing for you. So teach your child body safety early. Let them know that private parts are private. Private parts are not what anybody can play with. Children should not be allowed to touch each other's private parts. They should not touch other people's private parts. They should not allow other people to touch their private parts. Let them know. It's a no-no. The only time a person is allowed is when the child is being washed, and that is for toddlers, not a grown-up child or a school-age child. All right. So when a child, that is the only time the child is permitted. And don't ever think children don't know. They know as early as age 2. Once they can say mama, papa, begin to speak into their ears. Let them know nobody touches you here. This is when you want to mention their private part, just mention the right name. Don't call it cute names. Let them know what is called safe and unsafe touch. What is safe touch? Is if you touch my hand. This my hand now is safe. Nothing my face. But when you go beyond the parts of our body that is covered by cloth or the swim trunk, is your private part. Nobody has the right to touch you anyway. There is not a place that anybody should touch. Is your private part. So the best way to explain to the child is your bedroom is specially for you. Nobody just come to your house and enter your bedroom. That is how your private part is also. Nobody have any permission to just touch your private part. For what reason? It's not a toy. It's not something you should play with. So these are things we should do. And then teach your children to speak this full sentence. This sentence is so powerful. It's a whole full sentence. That sentence is no. No is a full sentence. Teach them to say no confidently and boldly. No is a powerful word. Let them know how to say no and accept no early in life. Because many people who become narcissistic or become all these leaders that become very narcissistic and all of that, because they don't know how to accept rejection. Rejections happen every day. Teach your children to accept no. When somebody say no, I don't want, let it be. They too should learn how to say no. They must learn how to say no. There's nothing wrong with saying no. So when somebody is trying to touch them in an inappropriate way, no is no, and they say it with confidence. Now, they should learn to tell if anything happens. In case they have done everything you have taught them, and somebody is trying to misbehave, they should report as quickly as possible. Nobody is too big to be reported. As a matter of fact, I've heard, I've gotten incidents of grandparents abusing their children. So don't excuse anybody. It's not about somebody is a pastor, is a church choir leader, is this, is that. No, 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 no. Nobody has the right to break their boundaries. Teach them how to build their boundaries early, early. And more importantly, or most importantly, help them to build trust. Let them trust you enough. Let them trust you, and make sure that you are a trustworthy person as well, because it's not about you trying to make a child trust you and you yourself, you don't have good boundaries. You break their boundaries. Let it be that if anything is happening, you are their go-to person. They can confidently speak to you without fear. So in closing, let me leave you with this: protecting children is not a one-time action. So what this is not a one-time action. So I believe as we continue this conversation, I can share you different ways you can teach your children sexuality education with daily life experiences. It's not something that it has to be a big deal. It's not something that you have to pray and fast about it, because some people fear when we talk about sexuality education. There's way people react. It's a daily conversation that feels normal, you know, and it shouldn't be a one-time thing. It is a daily responsibility. Your awareness can save a child. If you are aware, you have built your awareness to a level, and you can communicate with your child to a very, very confident level, you can protect the child. Your attention can prevent harm. Pay attention to your children, to the environment. Pay attention to things that are happening around you, and don't ever ignore any sign. Your voice can create safety. When you teach a child to protect themselves, you are actually protecting the future of that child, the generations yet unborn. If this conversation has helped you and you have been here so far, I really appreciate those that have stayed with me for this long. Make sure you share this video, make sure you like it, and subscribe to this channel, because I come here every Sunday 7 p.m. West African time to have this conversation with us, how we can be better parents, how we can raise children that are healthy, sound, and confident, and how we can build a very fantastic, loving, safe family. So make sure you share this channel with this video with somebody who will learn from it, and subscribe to this channel, like, and don't forget to comment. Even if you are watching this as a replay, I want to hear from you. What have you learned from this conversation? What is the one thing you are taking away? What changes are you going to make henceforth concerning your child safety when it comes to sexual abuse prevention? So remember that every protected child has a better chance to build a healthy future, and every safe child builds a stronger nation. So choose awareness, choose protection, choose to be different. I'll see you next week by God's grace on this conversation again, Save and Smart Parenting, in this series of Save and Smart Parenting conversation. So see you next week, and have a wonderful week, fruitful, blessed week. God bless you, and keep safe. Make sure you protect a child around you. God bless you. I love you. Bye.
I love you. I love